So I am Dr. Coby Harrison. I am an internal medicine physician. I primary care. I treat patients in clinic and see patients in the hospital. If any of my particular patients from clinic get sick or hospitalized, I see them at the hospital. I grew up in Mobile, Alabama, and I have 3 children aged 2, 4, and 7. I went to medical school at UAB in Birmingham after going to Spring Hill College and decided to become a doctor. Didn't really know what kind. I wanted to be an internal medicine doctor because we have lots of flexibility in what we can do. We can work in ERs and urgent cares, and you pretty much have a general idea about a lot of different types of medicine, and not just one specific specialty. And it's a very short residency of 3 years, and get paid pretty good as well.
Hi, my name is Robin, and what do you see yourself in 5 years?
Well, currently I have 3 small children, aged 2, 4, and 7, and I'm pretty busy with that at home and with my internal medicine practice. I work 5 days a week and see patients in the clinic and in the hospital, and so I've really built my practice to be pretty busy already as a primary care doctor. And in 5 years, I would imagine that as the kids get a little older, I'll probably work a little bit more, and probably will have transitioned at that point to just outpatient, because that is the trend for internal medicine practicing physicians, is to either be a hospital physician or a primary care physician. So I'll probably take on more administrative roles and be a little bit busier, allow for seeing more patients in clinic, and we'll probably have pulled completely out of the hospital in 5 years.
My name is Kaylee Morgan, and what have you seen during the pandemic?
During the COVID-19 pandemic, I've seen a lot of fear, a lot of hysteria, and I think that if we compare this to other pandemics that we know about in history, like the flu of 1917, the Spanish flu, and smallpox, I think the issue has been we didn't have social media. Now there's so much misinformation out there about what's really going on, and right now specifically, we're seeing the unvaccinated population really get sick with COVID-19. Our hospital is seeing a surge of COVID. In the very beginning, we didn't know what it was. We couldn't test for it as easily as we wanted to. So this would have been in March of 2020 when things were just starting. The coronavirus is a respiratory virus, and so this is pretty much what primary care does. Any viral upper respiratory virus is headache, runny nose, sinus congestion. That's usually viral. Sore throat. Patients usually think they have a sinus infection, but that is usually a viral upper respiratory infection. Coronavirus is a viral upper respiratory tract infection until it causes a dysregulated inflammatory response in the body a week or so after infection. And so in the beginning of the infection, you can't tell it from any other respiratory virus. And so in the very beginning of COVID, we shut down our multi-specialty clinic, and I opened up a tent in the parking lot for the ventilation purposes, for it to be outside and therefore not transmit the virus, so that we could screen people for symptoms and still see each patient that was sick with shortness of breath or cough, because not all shortness of breath and cough was COVID. And those patients still could have other things like pneumonia or heart failure. And so we set up an evaluation center outside in the parking lot, where we strictly saw patients for about 6 weeks. And then we started to open the clinic back up, with people wearing masks and limiting visitors, so that we could still practice medicine and see patients that were sick, because even in the setting of the pandemic, people still get sick with other things. I diagnosed several new cancers. I can remember being in the parking lot, and a patient was sent from urgent care with a big tumor on his neck, and he wasn't able to get into a primary care doctor's office anywhere because we had all shut down because of COVID. And I was able actually to schedule a CT scan and get him seen by an oncologist and evaluated that day by making phone calls and scheduling the CT scan out in the parking lot. I also saw and admitted several COVID patients from the parking lot. One of the things we had to learn, or I had to learn, was that we didn't have chest X-rays and lab work to really tell us what was going on. We didn't know if patients had COVID. We didn't have a rapid test, and so you had to really kind of go by the history and the possibility of exposure to determine if they were COVID positive. And the term that we came up with in the physician community is the silent hypoxia, meaning that patients looked fine. They didn't look terribly short of breath. Their lungs sound normal if you listen to their lungs with a stethoscope, but when you measure their oxygen level with an oxygen sat on the finger, it was in the 70s and 80s, which is terribly low and almost incompatible with life. And so everyone came through the tent with a ambulatory oxygen saturation. So we had them walk, and if their sats dropped, that was a really good indicator that they had COVID, and we could pull those patients out and see if they needed to be admitted to the hospital. Through the pandemic and over the summer of 2020, we got better testing. We got more testing supplies. It got easier. The caseload went down. And then, of course, in the fall of 2020, we saw a little surge with a big surge in January. But at that point, we had more PPE, and we were better able to handle it. And in the very early days of the pandemic, I was using the same N95 with a surgical mask over that to protect the N95 so that I could continue to reuse it. We didn't have cleaning supplies because just like everyone bought all the toilet paper and all the bleach off the shelves, we couldn't find anything to clean with. So we did have a period where we were really struggling there. But by January of 2021, that had improved, and we had the vaccine. Getting the vaccine, there was a really downward trend in the new COVID cases. And in June, we saw our lowest numbers ever, which is really, really discouraging now to see where our COVID cases are. And in June, we got as low as 0 COVID patients in the hospital. And this morning we have 150, and about 20 of those patients are on ventilators, and all of the patients that are on ventilators are unvaccinated. And essentially the reason that the pandemic continues and the virus is continuing to be allowed to mutate is because we have not been able to eradicate it with the vaccine, because there's so much vaccine hesitancy and fear from misinformation. But the vaccine is very safe and effective at preventing COVID and preventing the spread or slowing the spread, which allows us time to get the virus eradicated like we have previously with smallpox.
Hi, my name is Deja. Why are you a physician, and what makes you go to work every day?
So why am I still a physician, and what makes me go to work every day? Well, got to pay bills and got to have a job. But being a physician is kind of part of who I am now, and I've established a practice, and I have patients that depend on me. And if I'm not here, patients don't have their doctor. And I've developed relationships with patients over the last 5 years that I feel an obligation to my patients to be present. There have been times where I've not been able to be here, like childbirth, COVID, other sicknesses, or reasons for just not having to not be at work or cancel clinic. And I really feel a moral obligation to the patients that I have to cancel an appointment for, because they take time out of their day to come and see me, and if I'm not available, that's for one a big inconvenience for them, and they have to reschedule or get another day off work, and they may have a problem they really need to discuss. And so I feel an obligation to my patients, and it's really defined who I am as a person too. And so even, I do have a lot of demands at home with 3 children, and I would love to be more present for them. but I also could never see myself not working and doing what I do, because it's a special, I think, a privilege to be a physician, and to be able to share in patients' lives, all throughout their aspects of their lives, and be able to help people. And I enjoy it. Thank you to the Medical Society and the Boys and Girls Club for allowing me to speak to you guys. Becoming a physician is certainly obtainable. It seems like a long way to go, but you go to high school and you do well. As long as you do well in everything that you do, you don't shut any doors. You go to college and you do well, and then you have the option to take the MCAT and apply for medical school and get into medical school. And once you get into medical school, you usually finish. And so if you always continue to do well and keep your record clean, you will not have any doors shut, and then anything is a possibility. And I really appreciate the opportunity to speak to you guys, and wish everybody the best of luck, and go get your COVID vaccine, because that's what we really need right now.